From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
And welcome this Saturday to Medical Forum. I'm your host, Jeff Reed. My co-host, Chris Marr, is on vacation, so everyone will be envious of him. We'll wish him safe travels until he gets back. Hope everyone got enough rain over the last few days, so hopefully we'll have a sunny weekend. Want to get right into our guest today. Sumter Health and Rehab. Brooke Luce will be with us today, as Dr. Kim will too. So, Brooke, let's just start off with you. We're going to talk about your facility, your great facility, which I was fortunate enough, I think back in October, to go to the open house. And beautiful rooms. I noticed the flat screen TVs and everything. So I'm excited to hear about all the things that are happening with you and Dr. Kim. So, Brooke, give us a little background on yourself and some contact points on how people can reach you.
Sure. I've been in the healthcare community in the Sumter area for about 8 years, and I've kind of done a little bit of everything from hospice, home health, medical equipment. So I really am well-rounded in the resources that we have in the Sumter area. So that's a little bit of my background, and now I'm very happy to be with Sumter Health and Rehab and kind of rolling out our new rehabilitation program.
Well, let me ask you this, because a lot of people are going to be familiar with the old name, Mariner. Right. Mariner Health, Mariner East, Mariner West. So when we say Sumter Health and Rehab, the physical address is
880 Carolina Avenue. Now, we do have two buildings, actually.
Correct.
And they're right around the corner from each other. The other building is 975 Miller Road. And that is actually where our renovated rehabilitation area is.
So right down from the YMCA.
Absolutely.
So if I'm coming down Miller Road and I'm headed to Shoney's, do those two even go together? So I'm working out and then I go to Shoney's.
Right.
But that's good. I can stop by and see your facility.
Absolutely.
It's tremendous. Dr. Kim, thank you so much for taking time out of your busy schedule. We briefly spoke before we got on the air, and I'm excited to hear about all the things that you've done. Give us some background on yourself, Dr. Kim, education, what you do. I think it's going to be very interesting for everyone.
Thank you for having me on the show. My name is Dr. Kim, and I actually, prior to medical school, I was very interested in individuals in certain realms, such as sports, patients that had strokes, brain injury, spinal cord injury, and surgical patients who are very debilitated and they lost their function. I found a specialty called physical medicine and rehabilitation. That's a subspecialty in the field of medicine that specializes in those realms, especially those type of diagnoses. I had the fortunate opportunity to be accepted into NYU School of Medicine, Rusk Institute, under U.S. News and Reports is the number 8 program in the country, and it's one of the top rehab hospitals in the world, and it was the first rehab hospital in this country. So all these realms and the protocols that's been set for rehabilitation medicine was set under Rusk Institute at NYU in Manhattan. I had the opportunity to also be a medical director in South Carolina in a rehabilitation hospital that resulted in certain ideas that I realized certain patients and their family members were not very satisfied. And the company is called Precision Rehabilitation. This company allows a partnership with skilled nursing facilities to entitle and help patients that are in the short-term rehab section with certain diagnoses such as hip replacements, knee replacements, strokes, brain injury, spinal cord injury, or even just general patients that are debilitated and deconditioned. What we do is set a certain program that is equivalent and synonymous to a rehab hospital program in a skilled nursing setting, such as Sumter Health. And it's been very fortunate with the partnership. It showed a significant improvement in quality and also family satisfaction, and the patients were cared for more properly, and the program has significantly improved.
But how long have you been here? How long have you been working with Sumter Rehab?
It's approximately now 5.5 months to 6 months, approximately. And within that time period, there was a significant improvement from the time that our company with Precision Rehabilitation and Sumter Health has partnered.
Well, let me ask you this, Brooke, volleying it back to you a little bit. How do I get there? Is this a referral basis? Is it hospitals, a doctor basis? How do I qualify or say I have a loved one that has, as you mentioned, maybe fallen, broken her hip? She's gone through maybe extensive surgery, been in the hospital. What happens? How do I get to Dr. Kim?
The most common way to get to our facility is through the hospital. And basically, when you go in to see your orthopedic surgeon and they're talking about a joint replacement or a hip replacement, they go through scheduling it and you have it done. Depending on how well you're doing after the surgery, the case managers, the hospital at the hospital will make the decision on whether you would better benefit from continuing therapy at home or in an inpatient setting. And so at that point, they would refer to our facility.
Okay. So
they get everything that needs to be done together. And so you would just let the discharge planner or case manager know that I want to go to Sumter East Health and Rehab.
Gotcha. And so so you guys work very tightly with physicians here in town and surgeons, I would assume. Is that correct?
Absolutely.
And do you see the patient prior to Dr. Kim? Let's say that, Brooke, you're up and you get the referral and they're in the hospital, let's say on a Wednesday, getting ready for a discharge on a Friday. Do you do kind of an assessment so then you put kind of a game plan together, or do they end up, you pretty much know, Brooke, let's get them in here. This is what we do. And then at that point, Dr. Kim, you put your expertise.
That's a great question, Jeff. With the approval after Brooke has designated a patient appropriate for the short-term rehab patients, what would occur is the patients would come to our facility and there would be a consult to a specialist that deals with rehabilitation, and it would be me within that facility. What I would do is actually initiate and follow up on that patient as soon as the consult is proceeded and comprise a certain comprehensive program for that specific patient, for that specific diagnosis. So each patient that comes to the facility will not have the same program. It's going to be catered individually to each patient. Thus, it will not be a program where every therapist will always do the same exercises for that specific patient or utilize certain modalities such as heat, diathermy, ultrasound for that specific patient, because it really needs to be catered to the specific resident that's there, because they have different comorbidities, different diagnoses, and certain contraindications that should not be utilized for one type of patient or the other type of patient, even though they may have the same diagnosis. An example would be a hip replacement. If there happens to be a potential for cellular changes or active infection that's within
Dr. Kim, let me do this, because I think that is a big, we see a lot of hip replacements. So we come up on our first break. I want to follow up with that. I want to thank our good friends at Your Service Home Care on Wilson Hall Road, 1250 Wilson Hall Road, for sponsoring this first segment. And when we come back, I want you to follow up with that. Hip replacement is a big topic here in Sumter, and we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
Hello, this is Jeff Fall with the Toomey Foundation. Please join us for our 4th annual Toomey Foundation 5-miler run and walk, Saturday, June 13th, right here in Sumter. Proceeds go towards fighting diabetes, a leading cause of health issues in our community. For more information, visit our website or Facebook page, or call us at 774-9014. We hope to see you there.
This is Medical Forum, presented by At Your Service Home Care.
And we are back for our second segment here on Saturday morning. I want to thank all of our good friends at Toomey Foundation. What a fantastic hospital that we're blessed to have here in this town. And I also want to promote them a little bit. Big 5-miler coming up on June 13th. You can run, you can walk, starts at 8 a.m., if you have any questions about it, call the Toomey Foundation, 774-9014. I think they'd probably want to thank their sponsor at Anytime Fitness for that help, too. So good luck to everyone. If you're a great runner, it's for you. If you are a recreational runner, it is for you as well. Back with Dr. Kim and our friend Brick Luce at Sumter Health and Rehab. And when we left, we're talking about hip replacements, and that's been a topic on Medical Forum for quite some time. So getting back on subject with it, a hip replacement, talk to us about that. How often do you see that? Or broken hip? Maybe we just clarify it more as a broken hip?
Yes, Jeff. So you brought up a very interesting point. Significant amount of patients, as they get into age and in the geriatric population, there's a high risk for falls. And most times with the risk of falls could result in any type of hip fracture, which can be a femoral neck fracture, intertrochanteric fracture, and will require some form of surgical intervention, which is a hip replacement. Hip replacement, as you get older, has a higher comorbidities, a higher risk for potential death, and in conjunction, higher risk for debility after you leave the surgical procedure. Meaning, usually with a physiatrist, which is a rehabilitation medicine physician, we oversee that process to get them as strong and functional as possible, close to that prior functional level. With the case that there's a risk for also fatality, because hip replacement, if they're not being progressed and they're not being provided with appropriate range of motion and therapeutic regimen, there's a high risk for also a clot in that specific leg that's on the same side of the hip replacement. So most of the elderly population have a high tendency due to pain that they don't want to move their leg. However, it's usually contraindicated, and you really need to do that range of motion to prevent that clot that can lead to a pulmonary embolism and could be a very fatal result. So it's very important to have a rehab physician that oversees the post-surgical process to make sure your functional level will improve and you will have the ability to sustain good quality of life after the surgical intervention.
Just so I can mentally put that in my mind, if I'm having a hip replacement, and I'll be 50 next month and played sports my whole life, just like we were talking. You're a big tennis player yourself. Guys like Jimmy Connors have had double hip replacements before the age of 60. Jack Nicklaus. So in other words, a professional athlete, that's not uncommon. What kind of downtime? If I had a hip, let's just say a left hip replacement, and I came to your fine facility to see you, what are my expectations, assuming I'm a very compliant patient, I do what my doctor asked me to do, and my physician and the rehab and the PTs. What kind of time is somebody who's maybe out there listening going, oh, my hips kill me, but I don't want to go under the knife? Is it a surgery that you feel is something that you can come back from? We're all used to knee replacements and such. What talk us through the rehab, specifically in your facility, under your tutelage, to get me up and get me back in a normal, for lack of a better word, state of activity?
So that's an excellent question, Jeff. Regarding that question, the hip replacement time frame and the estimated functional improvements really will vary on the individual, whether they're compliant or not compliant, because each individual also, you have to recall, have different comorbidities. So they might have wounds that weren't healed prior, or if they have additional morbid obesity, various factors and variables contribute to your functional outcome. So throughout the course, each program is going to be catered to that specific individual after hip surgery to get them as functional as possible. But regarding time frame, it could really vary from 2.5 weeks to approximately 6 weeks of their functional improvements.
Really?
It really just varies on each individual. But the program will be catered to that specific resident that's going to be at the facility.
So I would think the three factors that would help to be on the side of the 2.5 weeks would be youth, what kind of shape you're in maybe to start with. So maybe you're cardiovascular, you're not obese, you're not diabetic and things like that.
Yes, Jeff.
And then you're very compliant.
Yes.
So let me ask you this, going back, when you mentioned your background in New York, doctor, you're an MD.
Yes.
Physical medicine, rehabilitation, physician, and help me out on this word. Physiatrist.
It's not a podiatrist.
So we're not going to be working on feet, and we're not working on the mind as a psychiatrist.
Correct.
Talk to me, because to my knowledge, I've been in the medical field almost 20 years. You're the first I've met.
Physiatry is a subspecialty that's relatively new in comparison to family medicine, internal medicine, general surgery. It occurred after a world war in which they noticed and utilized a tremendous amount of soldiers coming back with amputations, brain injury, and it resulted in a subspecialty called physical medicine and rehabilitation, which is also known as physiatry. And it actually became quite popular among many of the individuals because of the fact that a physiatrist has the capabilities of assessing the sports portion, post-surgical, any deficits you may have. A physiatrist will dedicate and comprise a specific protocol for that type of patient to make sure they're functionally improved. Meaning, the word functional is quite vague, and I would like to elaborate. It means individuals that have difficulties with walking, have a limp, making sure they get the appropriate orthotic, prosthetic that's necessary for that type of patient. Individuals that have an amputation, a physiatrist will monitor and provide the pre-prosthetic training, making sure they do not get contractures, wound care is appropriate, the stump shaping is certain examples, and will provide them with the appropriate guidance to eventually get to a prosthetic capabilities if they are within the realm of receiving. But most important, physiatrists will also judge safety awareness to make sure they are appropriate for specific orthotic and prosthetic, in which most physicians are not aware of. And a physical medicine and rehabilitation physician, also known as a physiatrist, are fully aware of certain regimens for therapy and also specific prosthetic and orthotics that are appropriate for that patient and your loved ones.
Well, and I don't think I've made any secret. I own reliable medical equipment, and we do prosthetics and orthotics. So working really in conjunction with you, so you can not only kind of diagnose it, you can speak a little shop with the Richard Barclays of the world, the CPOs down at Wynn Gasperson.
Jeff, you brought up a great point. Since you own the the medical company for prosthetic and orthotics. Individuals such as, I'll give you a perfect example where you would feel beneficial in comparison to other individuals who may
tell you what,
provide
because anytime I can get a plug-in for my company, I want you to take your time with it. So we're coming up on a second break here. I want to thank our friends down at Bynum Insurance. Give them a call, 469-3030. Go by and see Ed and Kelly and Karen and the bunch. And we'll be right back because I can't wait to hear what you say next.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports, WDXY 1240 AM and 105.9 FM.
Attention, calling all runners and walkers. This is Jeff Fall with the Toomey Foundation. Please join us for our 2015 Toomey Foundation 5-miler run and walk, Saturday, June 13th at 8 a.m. at the Toomey Regional Medical Center in historic downtown Sumter. Proceeds will benefit diabetes education and prevention. For more information, you can sign up at Strictly Running, Sumter Family YMCA, or visit our website or call 774-9014. We hope to see you there.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
This is Medical Forum, presented by At Your Service Home Care.
And we are back with our third segment. I want to thank our sponsor, Colonial Aesthetics. Go see Nancy Hunter, blending for your facial, your massage. And for all of you who listened on the show, the cool sculpting is a really cool way to lose some fat, unwanted fat. Give her a call at 774-2400. And we are back with Sumter Health and Rehab. We have Brooke and we have Dr. Kim. And Dr. Kim, one of the things that we were talking about was, with your background, one of the major assets that you give is that you can kind of speak the language of prosthetist, orthotist, and rehab, physical therapy,
occupational therapy, and speech language pathology. Yeah. Overall, throughout the residency program in physical medicine and rehabilitation, a physiatrist is trained to understand the appropriate management for prosthetic orthotics and all the therapy disciplines in which we speak the same language. But in conjunction, I also speak the same language as an internal medicine physician, a surgeon, and other medical specialties. So I have the realm of really understanding and honing in what's best for the rehab and improve the quality, because I understand tremendously the benefits from the therapeutic side and what the indications are, contraindications, and if certain orthotics, if they happen to have a foot drop or their hands are not working appropriately, I would order specific things and speak to someone specifically, such as Jeff, who owns the prosthetic company.
You know, that's one of the things that we like working with someone too, is we find, especially with a prosthetic limb, this is not a one and done. So being able to see, you may fit the prosthetic the first of a month, and then they could see bodily changes in 2 weeks.
Jeff, you brought up a great point. Your team would actually come and initiate and fit them appropriately. And during the training regimen, there might be certain things that a physiatrist would immediately notice. So I'll give an example of a below-knee amputation that has received a non-permanent prosthetic at that time. Some of the signs that I would be looking for is called choking signs, if there happens to be any redness along the stump line, things that I would need to be aware of as a physiatrist to make sure they're able to tolerate that prosthetic limb. And what I would do is work directly with the prosthetic and orthotic company and initiate if there needs to be any widening of the shaft versus if the fitting is not correctly, or if there happens to be anything called varicose hyperplasia where there needs to be a specific pad. This is when the specific prosthetic and orthotic company would come in and listen to my recommendations, and we will work hand in hand to provide the best quality for specific residents.
One of the things that we've tried to emphasize so much on the show, Dr. Marr, specifically as a physician, being able to have someone local, having you local, having reliable medical local, having our physicians, our surgeons local, to be able to then communicate. It's not something, we've talked about diabetic shoes a couple weeks ago, where people are sending in scripts to a physician like you, wanting someone to write a script for diabetic shoes, never seen the patient, never fit the patient. Of course,
that is not appropropriate, and it's not safe for the patients
it's not.
And their loved ones.
And that's something that I think you bring, and all the local people do. I understand when the time comes to go to Columbia or go to Charleston, if it's something that Sumter is not equipped to do, Toomey Hospital, for example, heart right now. But you know what? We got so many great physicians here. And prime example, yourself. You know, you're kind of a hidden jewel right now. Brooke, your facility is. It's a beautiful facility. Wound care is something that I know that you guys talk about and see a lot too. How do we get these wounds, and how can coming into a rehabilitation help speed up the recovery part?
With the wounds, Jeff, that's a point that's quite interesting, because a significant amount of patients that do come to the skilled nursing facilities have wounds that are quite significant or require supervision under qualified nursing staff. We have an excellent wound physician, and his name is Dr. Jim Morrison, who oversees all the wounds that require a specified physician that understands the wounds. So Dr. Morrison and I work hand in hand to make sure they get the best program, and we'll be able to be dispositioned to home or another home setting to make sure the wounds are taken care of throughout the course while they're receiving quality rehabilitation at the facility.
So let's say we have a patient come in and they've had a hip replacement or some other type of surgery. Not only is Dr. Kim assessing them from the rehabilitation side, Dr. Morrison comes in and he's also looking at the wound. So if this patient has a history of maybe not being able to heal properly or as quickly because they have diabetes,
right,
or whatever, it really, really helps to have Dr. Morrison there to be looking at that wound, making sure there's no infection. There's, it's red and beefy or whatever it is to make sure that it looks good and the patient's healing properly.
I know from the medical equipment side that to qualify, which we'll talk, Brooke, later about all the requirements, because I'm sure everyone's sitting there going, does insurance pay? Does insurance pay? What type of insurance? How do I qualify? But stage 2 breakdown in the buttocks area is when a medical equipment company can come in and fit with either a low air loss mattress or an alternating pressure mattress. Is that something that you, as at your facility, have to help heal these wounds?
Jeff, you brought up a great point regarding that issue. Individuals that do have the buttock wounds or skin breakdown that is extensive, as a physiatrist, what I would do is assess which is appropriate in case if they need a gel cushion versus an air villi cushion. I would designate to the therapy team that this is appropriate to help aid in the wound healing and making sure that in conjunction with Dr. Morrison that the wound is going to be appropriate, and in the course of their therapy in which they may have difficulties with proximal muscles and unable to stand, a significant amount of pressure is going to be put in their sacral and their buttock region, and we have to make sure the appropriate adaptive equipment is necessary to make sure they can continue with therapy and the wound is healing appropriately.
And you mentioned diabetes. I found that that's always a tricky road there to recovery, correct? I mean, so
Yes.
if you are a diabetic and we see, could these wounds be prevented? Is this something that predominantly, and we see that with artificial limbs where we see the wound that, like you said, maybe the limb didn't fit appropriately or they didn't use the correct amount of socks once they began to heal and they rubbed against it. I think prevention's the key we want to talk about, right?
Yeah, and I'm not a doctor and I'm not clinical. I didn't go to school for this. All I know is from what I've learned in my experience in healthcare. And in my experience, I've seen the biggest thing, especially for patients that are bedbound, is when you're bedbound, there's certain points of the body that blood pulls. Your sacrum, right above your buttocks, is one place that you would see a lot of wounds at. And the biggest thing for those types of patients that are, let's say, dementia all the way to the point where they're not speaking or moving, basically that would cause a wound in that area if they're just laying there not being turned properly, or you just have to get them up, turn them, that sort of thing.
As we finish our third break, we'll be right back. I want to thank again At Your Service Home Care, your concierge steward guide to home care and beyond on 1250 Wilson Hall Road. Stop by, give them a call at 607-9677, and we'll be right back.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
Hello, this is Jeff Fall with the Toomey Foundation. Please join us for our 4th annual Toomey Foundation 5-miler run and walk, Saturday, June 13th, right here in Sumter. Proceeds go towards fighting diabetes, a leading cause of health issues in our community. For more information, visit our website or Facebook page, or call us at 774-9014. We hope to see you there.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
We are back, Medical Forum. I'm your host, Jeff Reed. I appreciate all the listeners listening in here on a Saturday morning. Also want to thank our sponsors. In a special shout out to Toomey Hospital, and congratulations to Sylvester Owens. He's an RN. Earned the coveted statewide Palmetto Gold Award, which exemplifies excellence in their practice. So, Toomey, another kudos to you. Thank you for what you do for the community as we vector through some tough times, and we'll come out on the good end, I'm quite certain. Dr. Eric Kim, let's go back a little bit. You mentioned, I think, in the first segment, Precision Rehabilitation is the company that you started. Give us a little background on that. Where are you located? I know that, and Brooke will probably talk about this as well, when you have discharges, the people that want to choose your facility, if you're booked, then probably a question someone wants to know is, how do I still see you and all the things that you bring to the table, even if it's not in Sumter? So give us a little background on Precision Rehabilitation.
Thank you, Jeff. So with Precision Rehabilitation and being the owner, one thing I realized is most skilled nursing facilities had that lack of the rehabilitation care. And I think it's best for the patients and also the loved ones to make sure their loved ones are getting the best quality of care. What I would recommend is any facilities that has precision rehabilitation within the realm of their therapy program is going to provide the best care for the patients. We are actually affiliated with facilities in Sumter, Columbia, Greenville, and Charleston. We are the fastest growing rehab company in South Carolina because we provide the best quality of care for your loved ones and making sure the patients have utmost highest level of satisfaction when they leave the facility. And that is critical in my company because we want to make sure you will potentially refer your loved ones or your family members to the facilities with our company in there, being Precision Rehabilitation, that has partnered with multiple skilled nursing facilities. And every administrator and corporation within the skilled nursing facility have been ecstatic with the positive results within the decreased rate of acuities to the hospitals, more medical supervision from a physician that also has a background in rehabilitation medicine, increased functional improvement, increased patient satisfaction, and increased satisfaction from their family members, which is all important aspects working with the interdisciplinary rehab team. So I would highly recommend, if your family or your loved ones are in an acute hospital, to seek and ask if Precision Rehabilitation are affiliated with any of the facilities that you're planning to be destined to prior to you going home or in assisted living.
Well, I think something, so we don't get anyone confused on, you work with the team that they have already established. So
yes, Chef.
I know that you, Brooke, you got two fine physical therapists there in Lana Kay and Robert,
who are excellent. I work hand in hand with the entire physical therapy, occupational therapy, and speech language pathology at Sumter Health, and they are excellent.
And our rehab program manager, Wendy Reeves,
has been very positive in terms of the recommendations that I've provided to improve the quality of the program, and she's been a tremendous advocate for the physiatrist, which was myself in that facility.
Well, let's talk about, because we did talk about a broken hip, and we talked about hip replacement, prosthetic limbs, orthotics, stroke. And that is something that we see a lot in South Carolina.
Absolutely. We're along the stroke belt. So it's a tremendous amount of patients that are being referred to Sumter Health with CVAs, which is also known as cerebral vascular accident, which is also known as a stroke to most people.
Well, let's talk about brain injuries, because what I'd like to cover in this last segment, and I appreciate your time, and I know we need to be very liberal through this segment with your time. People are saying, is this a rehabilitation? So I just go when I have my knee done, hip. No, that's not for stroke. It is for stroke. Brain disorders. Examples.
An example would be an individual, and I'll give a perfect example because this is quite frequent. An elderly patient who lives independently without any family members has happened to trip on the rug and fall and hit his or her head, which resulted in an intracranial bleed, which is a brain bleed. They require some surgical intervention to relieve some of the pressure within the brain, and now has cognitive deficits, meaning that they're not able to process information or speak appropriately as their prior functional level. So that would be an instance where it could be considered a brain injury. And we would actually have specialists that consist of a physiatrist and a speech language pathology to work hand in hand to make sure we can get their loved ones and the residents back to their prior functional level or close to their prior functional level.
How about neurological disorders? What to the layman out there? What would I have?
Neurological disorders, Jeff, is a great question. Is a great statement that you're inquiring. It consists of individuals with Parkinson's disease, multiple sclerosis, individuals even who are very debilitated that have ALS. All these type of neurological issues, including any type of neuropathic issues that consist of individuals that have nerve damage, all of these consist of neurological disorders that a physiatrist who are specialized to provide the appropriate rehab program set certain protocols for these type of residents.
Okay. Musculoskeletal problems is where would that fit in differently?
Musculoskeletal is another great question. Individuals with hip replacements, knee replacements,
okay,
anything that involves the skeletal muscle. Most individuals with stroke, it's quite common on the research has shown that they have shoulder pain. Shoulder pain will be assessed by a physiatrist at the skilled nursing facility. Whether it will be determined if it is it could be a rotator cuff tear, impingement, versus even some depreciation within the scapular region, because after a stroke, a patient might be very weak on that arm and require a special type of modality that will be recommended through a physiatrist and spoken hand in hand with the physical therapist to see if this modality is appropriate to make sure it would reduce that musculoskeletal pain. For an example would be the shoulder pain.
So through Precision Rehabilitation located at Sumter Rehab, you can handle just about every physical therapy, anybody who needs any kind of rehabilitation.
Yes, sir.
As we close down on this segment, again, Dr. Kim, revisit us again. A little, your phone number. How do we contact you? Is it best to contact Brooke to line things up with you at the rehab? Give us let's take 30 seconds and give us some contact points and how we can get a hold of you.
Yes, Jeff, that's an excellent point. Regarding the contact, we work affiliated with the skilled nursing facility. Brooke would be a perfect example, who is the admission director and can direct any questions that are necessary to answer if they're appropriate for the short-term rehab or if they want to participate in a rehab program and are very interested in having a physiatrist on board. Some of the other factors in which they can request for our assistance would be just mention to the facilities if Precision Rehabilitation are affiliated with any of these skilled nursing facilities, and they can direct you to the appropriate individuals, such as Brooke, who would be able to answer that type of question.
Dr. Kim, we're coming up on a short break here. Got to pay sponsor. Thank you so much for your time. We've learned so much. My pleasure. And we'll be back for our last break with Brooke Lewis.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
Attention, calling all runners and walkers. This is Jeff Fall with the Toomey Foundation. Please join us for our 2015 Toomey Foundation 5-miler run and walk, Saturday, June 13th at 8 a.m. at the Toomey Regional Medical Center in historic downtown Sumter. Proceeds will benefit diabetes education and prevention. For more information, you can sign up at Strictly Running, Sumter Family YMCA, or visit our website or call 774-9014. We hope to see you there.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
When we were back for our last segment, Dr. Kim educated us beyond belief. I think I'm just now putting together, Brooke, all of what he does. But I think tremendous information. Your facility must be very proud. I do want to mention out to our sponsor, At Your Service Home Care. Thank you again for presenting the show, Medical Forum. Go check them out on 1250 Wilson Hall Road. Or catch them on the web, www.ayshomecare.com. Brooke, you got a lot going on over at Sumter Health and Rehab.
Absolutely. We're very, very, very proud to have Dr. Kim and Dr. Morrison on board with us. And specifically with Dr. Kim and his company, Precision Rehab, he is actually just partnered with our Seneca facility. So we're very excited. He's partnered with Sava Senior Care in general, and then our other facility in Seneca. So he's just signed on with them, and we're really excited to have him. We really think that gives us an edge and a niche in this market.
Well, you know what? Just from my being around your facility, tremendous improvements that you've made to them. Flat screen TVs?
Yes.
Can I come there if I'm not sick just to watch TV?
I wish it was that easy.
Okay.
And now, as I was saying earlier, there are a couple ways that you can come. I mean, sometimes, let's say your loved one goes in the hospital. What it takes and what pays for them actually, your loved one or you coming, would be your insurance company. Most of the time, what we see are Medicare patients.
Right. But you accept Medicaid?
Absolutely. We are Medicaid certified.
Okay. How about Blue Cross and all that? You probably don't see that as much because we're usually talking about people that have reached the Medicare age, we'll say.
We see it sometimes, and we see Medicare replacements. Those just require authorizations, and I just need their health information and their basic information to send in to get the prior authorization.
Now, 3 days seems to be something that is a marking point, I guess, to be able to come to the facility. If I'm in the hospital for 3 days, I qualify. But if I'm less than 3 days, I may not. How does that work?
Right now, let's say you have your mother at home, and she's just really declined. I mean, she hasn't had, you're not able to care for her anymore, or she just needs some intensive rehabilitation. She would have to have a 3-night stay in the hospital, which would, I guess, be 4 days. But it's called the three. You'll hear it in terms of the 3 midnight rule.
Okay.
And so whether it doesn't matter what she's admitted for. If she's admitted for a urinary tract infection or whatever, if she has those 3 midnights, is golden. Okay. It automatically activates 100 days under Medicare. Now, if it's a Medicare replacement like Care Improvement or Humana, or even if it's a commercial insurance like Blue Cross and Blue Shield, you'll have to get I would have to get prior authorization before admission. And I will say, Medicare or Medicare replacement plans like Care Improvement, they actually don't require a 3 midnight stay. So if you do have Care Improvement Plus and you're at home and you need rehabilitation.
Do I need a face-to-face from my physician, or at least a script? So if my mother's not feeling well,
right,
and she's dehydrated maybe, or she's just depressed, or we see signs coming along. I mean, when we get older, that's what happens. Goes in and sees Dr. Chris Marr, and Dr. Chris Marr says she just needs some rehabilitation, for whether it's from a speech standpoint, or maybe we detected a TIA or something like that.
Right.
That can get them in?
Absolutely, if they have Care Improvement Plus.
Okay.
And I can get that authorization. Dr. Marr knows what to do from there. I've worked with Dr. Marr several times on multiple patients. And he knows how to take it from there. You just let him know, and he'll take it from there. Now, if your doctor doesn't know, have him call Brooke Luce with Sumter East Health and Rehab, and we'll talk and collaborate. Now, if they have just traditional Medicare, red, white, and blue Medicare card, they do have to have that 3 midnight stay in the hospital. So 4 days in the admitted to the hospital. And from there, basically, or even actually, let me go back a little bit. Let's say they've been discharged from the hospital. She had that 4-day stay. You didn't think that you would need the inpatient rehab.
I'm going to take care of Mom. She's coming home. Right. We got it covered.
We can do this.
And then life hits.
Right. And then, or she just declines.
Right.
And sometimes that happens. Medicare gives a 30-day window. So if, patient was discharged on the 1st of this month from the hospital, 30 days, you have 30 days until you can call me and say, hey, I need to get my mom admitted, and we can do that.
Now, in your facility, how many beds do we have? Because you're the largest, is that correct?
We are the largest facility in Sumter. We have we're licensed for 176 beds.
Really?
Yeah.
Wow. And that's the east and the west side. And we've got about 2 minutes left. And one of the things, again, so there's no confusion, because I know we have other rehabilitation places that start with Sumter. This is Sumter Health Rehabilitation.
That's correct.
And you have 2 physical addresses, correct?
Correct.
One off Carolina?
880 Carolina Avenue. And then the other would be 975 Miller Road. And I'd like to also give the phone number,
please,
as well. To the actual facility is 803-775-5394. You can ask for Brooke, and I give tours all day, every day.
Okay.
Just call, make an appointment. I also can give out another number. It's my actual work cell, and it's 803-840-7515. If you're listening to this and it's kind of hitting home for you, give me a call. I'll talk to you individually and see how we can help.
So they may call you and it's not quite the appropriate time, but you can at least set up and say, hey, you know what? If you see that decline, using your 3-day example, they've come home 3 days, they've looked at it, been in the hospital. No, we decided what we want to do, Brooke. Thank you for your information. We're taking her home. You're always there for her, them as an ally, that when those 30 days come or in between it, they call you up and say, we've thought it. Yeah, we need that rehabilitation. I think what's nice, this is not putting your mother in a nursing home. No. They can be there 20 days, and Medicare will pay for it all, right?
The first 20 days, Medicare pays 100%. The next 80 days, Medicare pays 80%. The majority of the time, patients have a supplement or they have Medicaid. We have someone there if they don't have Medicaid that can help with that application process. And so really it's the first 100 days.
So you guys will help. If I come in with straight Medicare and I don't have that supplement, then I don't have to have money out of pocket. After those 20 days, you'll help me work to get Medicaid. There's 2 types of Medicaid. And Brooke, what I want you to do one more time is give us the physical address and your phone number. We are coming up. Time has flown this weekend, but we'll do it again. And but again, Brooke Luce, Admissions Director at Sumter East Health and Rehab. You're right there on Miller Road. Phone number again, Brooke?
803-775-5394. If you want a specific consultation with me, you can call me at 803-840-7515.
Brooke, thank you and have a great weekend. And thank you to Dr. Kim.